name is Min Zhu. My title is Director of East Kootenay Imaging. The reason why this topic is important is because medical imaging is a very sought after service, and unfortunately there is a wait list, and we want to make sure that the patients who need the most urgent examinations are indeed booked for their examinations in time.
When I order imaging and I send it off, I do have an expectation that it will happen within the time that I ask for it, but the reality is that it doesn't happen. And I think there's many reasons for that, but one of the biggest reasons is that we all think we can kind of jump the line by saying that everything is urgent.
The physicians are trying to do what's best for their patients, but they must probably, for the whole healthcare system, if they ordered appropriately, time-sensitive investigations, the whole system would work better and end up having better care provided for a bigger group of people.
It is extremely important that we get an appropriate and pertinent history. And again, there are a number of reasons for this, and the most obvious is that then we can answer the clinical question that you're asking, and we can actually provide useful information directed to the provisional diagnosis.
The requisition is incredibly important, but it's the information that we provide on that requisition, because that's all the radiologists have to go off on. So the mini referral or the requisition is my way of communicating that with the radiologist. So the more relevant clinical information that I provide on that requisition, the better quality report the radiologist can give to me. Because in the end, we all want to solve the problem and we all want to give our patient the right diagnosis.
We don't know these patients as well as our referring physicians, and we rely on our referring physicians to tell us the urgency of the examination. That's the most important reason. But secondly is that the priority numbers that are assigned to each requisition does determine what we do with the requisition. When we receive a P2 requisition for any modality, we try our best to fit them in within a week's time. And currently, the number of P2 or requisitions far exceeds the amount of appointments slots we have available. I think a lot of physicians understand the situation, which is that we simply cannot at this time provide 1 week service for all the P2s in CAT scanning. We do that for MRI at a fairly constant rate, and I would say that the MR appropriateness that on their orders are good. So what this tells me is that a lot of physicians are indicating P2s with the hope that they would get their patients ahead of the line, ahead of patients who perhaps can't wait for elective cases.
So our goal with this video is that how can we make physicians aware that the CT Prioritization Guidelines exist? Just know about it, and if in doubt, go check the guidelines. Between 50 and 70% of those requests are not truly patients that should be done within 7 days. They can actually wait 14 days or 21 days or 31 days. So I can see from radiology's point of view, they are always behind schedule. They can never meet their timeframes because perhaps from a referring perspective, we could be better at how we prioritize the test that we want.